In this tutorial, you will learn how to scan for implant crowns with iTero Lumina scanner. The case shown is 3 implant crowns in the upper right quadrant. The video includes pre-treatment scan with temporaries and bite registration, scanning the arch with scan bodies in place, reviewing the case, scanning the temporary restoration outside the mouth. Pre-treatment scan. Retract the lips and cheeks and maintain moisture control. Reduce excessive intraoral light before scanning. Scan the occlusal of the arch with an occlusal sweep to ensure seamless stitching. Roll to the palatal to fill in missing anatomy and complete the pass. Tilt slightly buccal to fill in missing anatomy without rolling too far, causing discomfort for the patient. Avoid holding the wand too parallel to the buccal surface. Follow the real-time scan assistant marking to identify any missing areas. Next, scan the opposing arch, occlusal, lingual, then buccal surfaces, managing the tongue and moisture throughout the scan. Lastly, capture the bite registration. Have the patient close their mouth in centric occlusion. Insert the wand while the patient is biting to avoid any bite discrepancies. Then turn the wand on and capture 3 to 4 teeth in a wave-like motion. Make sure not to cross the midline. Turn the wand off and then follow these same steps for the opposite side. Verify you have captured all the anatomy before scanning the scan body. Scanning the arch with scan bodies in place. After removing the provisional restorations and placing the scan bodies into the implants, and the proper seating is verified with an X-ray, the scan bodies are scanned as part of the full arch. Switch to monochrome mode. Hover slightly away from the scan bodies to capture at least 2 at a time, then continue scanning the framework of the arch. Roll to the lingual to complete the lingual pass and then scan the buccal. Use the real-time scan assistant to fill the blue around the scan bodies as you go. Make sure you clearly capture the scan bodies from every angle. Their surfaces should appear smooth and free of bubbles to ensure accurate alignment. Post-processing. Tap View mode to view the fully processed case and evaluate it before sending. Make sure each scan body is scanned from all angles. There should be no voids in the critical areas, including any adjacent contact. Temporary restoration scan outside the mouth. In this workflow, the doctor needed an additional scan of the temporary restorations outside of the mouth. This will give the lab more information regarding the final restoration. Open a new scan, fill in the RX, scan the case, and then send it to the laboratory. Enable the appliance scan. Scan from the occlusal surface first. Slowly rotate around the restoration, capturing all contours and surfaces. Then send this separate scan to the laboratory and they will combine all of the scans together in one file to create the final restoration. This extra reference gives the lab more information to reproduce the emergence profile and embrasure, helping guide the final restoration toward a predictable, natural-looking outcome. Summary? In this video, we reviewed the workflow and best practices when scanning for implant crowns using the iTero Lumina scanner, including the pre-treatment scan, scanning the arch with the scan bodies, and scanning the temporary restoration outside the mouth. It starts with iTero.